So for babies that have lots of ear infections, one option for treatment is the insertion of ear tubes. Ear tubes are tiny little plastic tubes that are inserted into the eardrum. And the reason tubes work is because they do the job that the eustachian tube is supposed to do. If you look up here at this diagram, you can see this is the ear canal, and the eardrum. And the eustachian tube is the tube that our body has which allows fluid to drain out of the middle ear. When the eustachian tube isn't working and fluid is trapped in the middle ear, we can relieve that trapped fluid by making a tiny incision in the eardrum called a myringotomy, and then placing a little tube through that incision. And that allows fluid to drain out this way and air to come in this way. And the middle ear is then ventilated through that tiny tube. The tube then does the job of the eustachian tube, and that allows you to treat ear infections differently. Instead of taking oral antibiotics for an ear infection, we can then give antibiotic ear drops, which can go through the tube and treat the infection. The tubes also reduce the frequency of ear infections. Kids who have ear tubes that frequently had ear infections have far fewer ear infections when the tubes are in place. In general, the tubes last for about a year and fall out by themselves. Now, sometimes the tubes don't fall out, and in about 2% of cases we have to go back and take them out. And sometimes the tubes leave a little hole in the eardrum when they fall out, and this would need to be repaired. This happens 2% of the time as well. So those are some of the potential risks of tube insertion. For children who have lots of ear infections, and that's generally defined as more than 3 infections in a 6-month period or more than 4 infections in a year, tube insertion may be an option.